Federation. And the first thing is to bring the warmest regards from our president, Professor David Wood, who is in other places of the world working for our organization. So in the next 15 minutes, I will try to share with you to address the topic of roadmaps and to answer what, when, where, why, and how to use this tool. I have nothing to disclose for this talk, and I will start in saying that you know, it's well known that non-communicable disease are now the first reason of death all around the world for both sexes. And here you have the most important thing, that most of the death for non-communicable disease are occurring in people aged less than 70 years old in both sexes. Focusing in cardiovascular disease, you have here the prevalence of cardiovascular disease all around the world, and you can see here the high rate of death due to cardiovascular disease all around the world. So, non-communicable disease, and it's diabetes, cancer, pulmonary chronic disease, and cardiovascular disease, including stroke, are the four main causes of death all around the world. That's why the World Health Organization started the program 25 by 25 to try to decrease 25% the overall mortality from cardiovascular disease, cancer, diabetes, and chronic respiratory disease for 2025. The goal is to reduce this mortality, especially the premature mortality, and these are, you can see here, the 6 of the 8 components of the tools to reach this aim: to cut the harmful use of alcohol, to increase physical activity, to decrease salt intake, to decrease tobacco use, to decrease hypertension, not to increase obesity and diabetes, and to make available essential medicine and basic technology for all the population. So, what's our role from the World Health Federation? We gather all the society and foundations interested in cardiovascular health all around the world. So we are trying not to compete with big societies as European Society of Cardiology, American College, American Heart, making new guidelines. We have too many guidelines around the world. So what's the tool we design is this called a roadmap. And what is a roadmap? A roadmap is, let's say you have to go from here from Beijing to Shanghai. So you look in your telephone, your GPS, and look for a route to go, this one, to go from here to Shanghai. And looking what are the problems in the routes and how can we reach Shanghai very early next Monday, next week. So here you have one point, the global burden of cardiovascular disease, and the other, and the final point is to reduce by 25% mortality for cardiovascular disease in 2025. This is where we are starting, and this is our aim. So, informal way, what's a roadmap? It's a framework to identify roadblocks and suggest potential solutions covering a large range of potential issues on the way to 25 by 25. Roadmaps have been developed by experts for all continents to detect problems and to offer solutions on specific topics impacting cardiovascular mortality. They can serve as models for regions and countries to develop their own roadmaps. Roadmaps is not from WHF region to the others. It's a common framework to work. And to create or update their national non-communicable disease action plans. Roadmaps offer a framework to bring together stakeholders with the objectives of determining, prioritizing, and implementing solutions to reduce premature cardiovascular disease death in a specific context in a collaborative and consultative approach. When is a roadmap useful? We think the roadmap is useful always. Always you have to go from one point to another point. It's good to have a roadmap to figure how to reach the objective. Where to apply the roadmaps? Everywhere. It's important that roadmaps can offer a framework to governments, NGOs, patient advocacy groups, health activists, healthcare professionals, and many others to trigger action to reduce cardiovascular premature mortality in their countries. With a collaborative approach in mind, they can involve health advocates, corporations, academics and research institutions, policymakers, healthcare professionals, patient advocacy group, etc. It's important to adopt the roadmap at the national level, making a situation analysis, making policies, implementing select tailored solutions, and finally building this big tool that is roadmaps. Here you have an example from India that adapting the roadmaps from World Health Organization at the national level. You can see here in this couple of pictures people working and discussing about what's the barriers to reach the objective of 25 by 25. Why to use the roadmaps? Let me show you here the treatment cascade for patients with known cardiovascular disease. The estimated efficacy of our cardiovascular interventions are about 75%. But the real effectiveness at the population level is only 21%. So we know a lot about how to prevent and to control disease, but the implementation is losing. You all know this picture from Salim Yusuf showing in coronary heart disease and stroke that upper middle income countries, lower middle income countries, and low income countries are not using the proper drugs for coronary heart disease and for stroke and for the other non-communicable disease. So let's go again to the roadmaps. We have here the global burden of cardiovascular disease. Here we have our aim, and we can study the main causes of cardiovascular premature mortality in my community, the cost-effective intervention, the feasible, acceptable, scalable intervention that I can do, the care gaps. I can so build the roadmaps and what's very important to adopt that to a national, to a community level, to a province level, etc. Just to finish, how to build a roadmap. First, you have to conduct research. What kind of research? Research about your reality, which is your reality about cardiovascular disease, about risk factors, about anything you have to about that. Second, to identify your strategies about that, your targets. To create partnerships, it's important to create alliance with other society, with community, with governments, etc. To engage the media, and finally to develop and disseminate the key messages to reach our 25 by 25 objective. Let me show you what's the roadmaps we have today. We have today roadmaps about atherosclerosis, about tobacco control, about hypertension, very important rheumatic heart disease for many regions in the world, non-valvular atrial fibrillation, and cholesterol. And we are preparing now the roadmaps about diabetes and cardiovascular disease. These topics have been identified on the basis that they are potentially make the biggest impact on premature mortality by 2025. And you can get all this information in Global Heart. This is the official journal of the World Health Federation, and it's free in the internet. You have to, in our page, many toolkits to use with your patients, with your students, because we have to change our curriculum about cardiovascular medicine. And just to finish, and this is important for Nushin to show this, this is to invite you to Dubai, in the United Arab Emirates, not next December, next year, in December, the 5th to the 8th, to the World Congress of Cardiology and Cardiovascular Health. We put our focus not in disease, but in health. Cardiovascular health is our most important aim. And with that, I want to thank you for your attention. Thank you for the invitation. I hope to be here in China for not only for 3 days, but for 3 weeks or 3 months to visit all this very nice country. Thank you very much for your attention.